Fraser Health has programs and practices that aim to reduce the harm for people that use substances and for the community. We call this harm reduction. Harm reduction is healthcare.
We respect people who use drugs and treat everyone with dignity and compassion. Harm reduction is healthcare.
We support people who are at risk of overdose by creating options and spaces for them to use more safely. Whether that's peer witnessing, overdose prevention sites, or new technology like the Brave and Lifeguard apps. Harm reduction is creative. Harm reduction is healthcare.
Harm reduction is grounded in justice and human rights. It focuses on positive change and works with people without judgment. Harm reduction is dignified. Harm reduction is healthcare.
Harm reduction supports people to make personal decisions about their drug use. We help people reach their health goals. Everyone, including people that use drugs, has equal access to care and support. Harm reduction is person-centered. Harm reduction is healthcare.
The ways our teams support people who use drugs are practical and have a positive impact on the individual and community health. Harm reduction is evidence-based. Harm reduction is healthcare.
Harm reduction creates space for safety, choice, collaboration, and trust. Harm reduction is supportive. Harm reduction is healthcare.
Harm reduction includes services and practices that support people to stay safer while using drugs. This includes education on safer use, access to supplies to support people to use more safely, take-home naloxone kits, and access to drug checking services. Harm reduction is knowledge. Harm reduction is healthcare.
Harm reduction aims to reinforce positive change, no matter how small that change may be. Harm reduction is practical. Harm reduction is healthcare.
Drug checking allows people to understand what's in their drugs and to make informed decisions about their use. Harm reduction is empowering. Harm reduction is healthcare.
Partnering with people who use drugs in developing their care plan leads to better health outcomes. Harm reduction is collaborative. Harm reduction is healthcare.